Welcome back to West Texas View.
From the veterans, okay, how long have you been here?
Welcome back to our program. Daniel Marsh, the director of the West Texas VA Health Systems located in Big Spring, and Laurie Phillips, chief of nutrition and food services at that hospital in Big Spring, are here to talk about all the services and health care available to our veterans in this area. And before the break, we were talking about how this all fits in together and how some services are taken care in different hospitals, and the facilitation that you do between each other, not only to help the patient with the cost of going between the two facilities, but also to make sure that patient gets the best and proper care and the most appropriate care. But also, one of the things that I remember happening a few years ago, there was a lot of controversy about the waiting lines. And is it because of this system that you in Washington developed that enabled us not to have those waiting lines anymore? We move those patients through without having to sit and wait to be served.
Well, it certainly has given the providers a lot more tools and a lot better ways to manage their patients that they have. We've established a number of performance measures, for example, and the performance measures have either a red color or a blue color, blue being the desired color, meaning you're exceeding that performance measure. For this year, this fiscal year, all of our performance measures, and there are like 25 of them, have all been blue. As far as I know, we are leading our vision in that respect. In terms of waiting times, we monitor waiting times very carefully. We're very mindful of that. Because of some of the waiting times we're experiencing at some of our community-based outpatient clinics, particularly in Abilene and San Angelo and Odessa, we are in the process of expanding our services there, expanding our facilities. We want to do that so that we have better capacity and larger capacity to help our veterans get processed through and get seen and get taken care of. So that's involving looking for new space and things like that. Some of our electronic tools also help us with that in terms of when was the patient registered, when did they come in, how long have they been waiting. We can track that. We can tell, and we can also go out and do a physical survey out in the waiting room if we have to and say, okay, how long have you been here? We do that because we're very concerned about our customer satisfaction scores. We do care about what the veterans think. We do care about their opinions. We like to hear from our veterans, and they're not shy about telling us when things aren't right, which is a good thing.
That is a good thing.
If something's not right, we want to know it and we want to get it fixed. So we're constantly evaluating things like that. We have several avenues for our veterans to voice their concerns. I get any number of calls on a daily basis into my office alone, and we refer those calls to the right folks that can get them the answers and get them taken care of.
But you serve as many people as you can in their home area without ever having to go to the hospital.
Yes.
And so that's your goal, is the more people you can take care of and in their home communities or close to their home communities and not ever have to come into Big Spring to the facility. But if they do, they come in and they're evaluated. Maybe this is the first time they've been in. Or maybe they've been in before, but you have their records, they're evaluated. And what if they have something that they need, they have multiple problems, and they have something that they need at your facility, but they need something somewhere else, that they're going to, some kind of surgery that you don't do. So they may stay for a while there and then be referred to another place.
Depending on what's going on, we will take care of them with what we can take care of in primary care right at Big Spring. If we know that they need something from another more complex facility like Albuquerque, which is our main referral center, we will get with the Albuquerque folks. We will find out, okay, how soon can you take this patient, and we will make sure that veteran gets up to Albuquerque and gets that care, whether it's some kind of surgery or some other fairly extensive procedure. And we refer quite a few patients to Albuquerque on a yearly basis.
So you're talking about primary care for mental, physical, and nutritional problems, chronic problems like diabetes and...
We treat a number of patients that have diabetes. We have a small inpatient component in our medical ward. We also have a 40-bed community living center, which is our geriatric part of the VA, which is our nursing home. We pretty much run a full house there all the time. We also, of course, work with our state veterans home, Lehman Lusk, right there in Big Spring. We also have an inpatient contract with Big Spring State Hospital for mental health services. We do not have an inpatient component at Big Spring, but we have treated, for example, last year we had 725 inpatient stays at the West Texas VA there in Big Spring. We had over 152,000 outpatient visits throughout the West Texas campus. So we stay busy, and we're very much focused on bringing new veterans into the system who've never enrolled in the VA, and we do that through a number of outreach activities. We attend a number of health fairs throughout the West Texas area, and we're always looking to enroll new patients as well as bring patients back who, for example, may have not been to the VA in 5 or 10 years, and for whatever reason they've just not chosen to come back. We're very interested in getting those folks re-signed up with the VA and getting them back in to see our primary care doctor so we can give them the best care possible.
Well, one of the things that I've noticed is that you're doing more and more outreach programs to identify those veterans everywhere, including the homeless veterans, and I think that's an area that we sometimes forget. A lot of people just sit and wait for you to come in, and we'll serve you if you come in, but now you're actually actively trying to outreach to those people that maybe for one reason or another just never have thought what a valuable opportunity this is to go to the pharmacy. Even if they have a personal doctor they've gone to all their lives, they could still use the pharmacy. We've got so much more to talk about the VA. I call it the VA hospital, but now it's called the VA health care system. And we're going to be back next week and continue this conversation with Daniel and Laurie about the VA health care systems. Any of your friends and family that are veterans, have them to be sure and be here next Sunday at the same time and listen up to the good information they're going to be shared. We'll see you next Sunday with another program.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.